Hello and welcome to NCTV episode 55, which is all about common cycling injuries and how you can avoid them. Unless you fall off, cycling is actually a sport blessed by its body friendliness. In fact, riding big miles is more likely to get you fit than fractured. But like any endurance sport, cycling can produce a catalogue of niggling aches and pains, which, if left untreated, can become more serious. To give your pain a name and point you down the right road to recovery, we'll cover the 5 most common cycling ailments, their most likely causes, and how to go about fixing them. There are 2 main types of cycling injury, those caused by falling off, which we won't cover here, and the other issues caused by overtraining, like biomechanical stresses, often due to muscle imbalances and incorrect bike setup. It is particularly important for the sake of future injury prevention to identify the root cause of the problem and address it ASAP. So first up, we have knee pain, and one of the most common cyclist knee complaints is pain under the kneecap. This is most likely to be patellofemoral pain syndrome, PFPS, and this often is worse when walking up and down hills or stairs, sitting for too long a period of time as well. And it may include wasting of the quad muscles at the front of the thigh. If the injury is an old one, then also tightness around the knee joint, and this occurs when the patella, kneecap, rubs on the femur bone underneath it, and it's believed to be an incorrect tracking or gliding of this patella over the femur, which can be a significant factor in resulting in the damage of the cartilage underneath the patella. And this may be from external factors like an increase in training, the seat being too low or riding too long in big gears. Internal factors such as poor patella tracking may result from excessive pronation, flat feet, rotation of the lower leg, and tight or weak muscles around the pelvis and thigh. To help avoid this, try varying your pedalling rate or cadence, breaking up your training by pedalling in a high cadence between 90 to 120 revs per minute can help to prevent injury. Raising the seat if it's too low will reduce the amount of knee bend and utilise more of the hamstring and buttock muscles, thereby offloading the quadricep muscles at the front of the thigh and the patella tendon in turn. Also, if your foot rocks from side to side, use an insert to stabilise your foot, thereby reducing the strain on the knee and increase your efficiency. 2, and next is back pain. After knees, the back is probably one of the biggest causes of pain for cyclists, with lack of flexibility and bad posture generally the cause. Hunching forwards over your bike, and probably at work also, that places strain on the spine, loading the structures for prolonged periods of time. Cyclists' back pain is often due to mechanical factors, so a first port of call is to have your bike properly fitted to your body. After that is all sorted, then it's good to look at your body itself to see where you need adjusting. Lack of flexibility, such as excessive hamstring and hip flexor tightness, can contribute to lower back pain. Differences in leg length are also common mechanical problems, leading to imbalances in your spine. Core strength is very important to avoid lower back pain, and this comes from strengthening a collection of deep muscles, both big and small, that work together to give you lumbar and pelvic stability. A few more tips. Lower back pain can arise in cyclists that push big gears, especially while climbing. The angle of your back in relation to your bike can increase or decrease the strain in your back, so consider alternating climbing positions by standing up or changing your angle of your back, especially during long rides or climbs. Or talk to your osteopath or physio, for example, about a back rehabilitation program to focus on strengthening your aforementioned core muscles. 3, neck pain. Neck pain from cycling usually stems from poor posture and weak muscles. Pain caused by neck hyperextension is made worse by positional issues on the bike, combined with a lack of flexibility. Just as you have core stabilizers around your lower back, you have stabilizer muscles called deep neck flexors around your neck to hold your head up. When your neck stabilizers are weak or fatigue quickly, it's left to your trapezius muscle, that goes from your skull to your shoulders and upper back, to take over, to support your head as you lean forwards. And when these standing muscles fatigue, you can experience pain in the back and sides of your neck. You can restore the balance by keeping your neck muscles loose and relaxed through a routine of strengthening and stretching exercises. Other tips: change your posture on your bike. If you're reaching too far forwards or your handlebars are too low, shorten the stem to shorten your reach. Raise your bars, and riding more upright will reduce the strain that you're putting through the back and your neck. Don't forget to change your hand positions at regular intervals too, and sit up on the bike to stretch, straightening your neck and back to vary the loads on different muscle groups. 4. Iliotibial band pain. While it's more commonly known as runner's knee, ITB syndrome is another common cycling injury. ITB pain is typically associated with prolonged repetitive activity. Symptoms can include pain on the outside of the knee, tenderness, and sometimes swelling. In some cases, if the pain can be felt simply walking or going upstairs and downstairs. You may also feel stiff or tight after periods of inactivity. The ITB is a tendinous band of connective tissue that originates from the pelvis and is attached to the outside of your knee. As your knee bends and straightens repeatedly, the band becomes inflamed, rubbing over the bony protuberances around the knee. Other contributing factors include tightness of the thigh, hip, and buttock muscles, as well as weak pelvic stabilizing muscles. To help prevent this, ensure that your seat is at optimal height for your body. If you overpronate or are flat-footed, you may need orthotics or a wedge inside your cycling shoe to stop the leg and knee rotating inwards, putting further tension on the ITB. Tucking the knees in too tight to increase streamline will also add to the tension and greater friction to the ITB. 5. Achilles tendon pain. The Achilles is the tendon at the back of your ankle connecting the calf muscle to your heel. If your Achilles is sore during or after riding, you may have Achilles tendinopathy. Inflammation, microtears, or compromised blood flow from overuse can often cause this and subsequently put a stop to your riding season. There are a whole host of stretching and strengthening exercises that you can do to help, and again, these are best tailored to you by your osteopath, physio, or other therapist of choice. In terms of advice and to help your Achilles, having your saddle too high means your toes will be pointing down too much, causing constant contraction of the calf muscles. How's that for alliteration? And load the tendon. Therefore, lowering the seat and making sure that your cleats are pushed all the way forwards towards the toes will help to even out the pressure on the muscles that you're using to pedal. So there are your 5 main cycling injuries. Remember that these are predominantly overuse injuries and they can be prevented. Think A.B.C. A is for alignment issues to be addressed, such as muscle weakness, flexibility, leg length discrepancies, and being flat-footed. Then B is for bike setup, which you'll need to check to see that everything is as it should be, correct height and position for you to enable the correct technique and cycling posture. Finally, C is for condition yourself with appropriate strengthening and stretching exercises. Remember to progress your training moderately and always listen to your body. That's it for this week's bite-sized bit to help your health flourish. Bye-bye for now.